introduce Jessica Miner, who in fact is one of our PCORI Award participants, and she is sitting on our communications committee. Jessica, thank you for being here today.
Thank you so much. Can everyone hear me, hopefully? So as Dr. Tosi mentioned, my name is Jessica Miner, and I am on the communications committee for the PCORI Award. And I would like to introduce Dr. Amy Corneli, an associate professor of population health sciences at Duke University School of Medicine. She also serves as the director of QualCore, a group of social scientists that partner with clinical investigators to conduct qualitative research. Dr. Corneli's work focuses on capturing patients' experiences and guidance through research and using the findings to inform subsequent clinical research and healthcare decision making. Welcome, Dr. Corneli.
Thank you. Hopefully everyone can hear me. I'd like to say thank you to the OI Foundation for including us at Duke in this really meaningful project. We have learned a lot so far with this collaboration and looking forward to moving forward. Like Courtney, I am going to stop my video. There was a little bit of hesitation with Courtney's presentation and before, so hopefully that'll help a little bit with mine. And I'll come back on again later on with questions and answers. So I'm going to share my screen. Well, here we go. All right. So I will talk more in detail about what Courtney started, specifically how to engage patients in PCOR research. The slides I know are hesitating but when we first try to change them. They still are. There we go. All right, so I will talk about 6 topics in the next few minutes. I'll talk a little bit more about patient engagement, although Courtney did obviously a wonderful job in talking about that. Talk a little bit more about why we engage patients in PCOR research, or in PCOR. And then really, what are the best methods out there, or the best practices that we've learned so far about how to engage patients? And also, what are the key principles to follow? A lot of people have been doing PCOR type work or just patient engagement for quite some time, and there's a nice evidence base of what research principles or what key principles are out there for us to follow. And then I'll wrap it up with how do you get started? How do you identify patients? And then what are the next steps to really start this process? With patient engagement, it really is a hot topic for a while now. And there's many definitions out there, many approaches, but I pulled these 2. These are from PCORI. These were also on Courtney's slides on really the essence of that. You know, the patient-centeredness is really what's important, that you're engaging with patients to find out what really matters most to them, what outcomes matter to them, and then you design the research around those outcomes, and that they're engaged, that patients are engaged, other stakeholders are engaged throughout the entire research process. So during research development, implementation, and dissemination of findings, you are including them. And regardless of the definitions, the underlying purpose of engaging patients, this ultimate objective, is to use those findings from patient-centered research to help patients make informed decisions about their healthcare options. And they can make those informed decisions because the information that they're given from research was designed to meet their needs. And so it answers the questions that they have and helps them make those decisions. And then it also gives providers the evidence they need to be able to make research decisions and healthcare decisions. And they can trust that data because they know it's patient-generated. They know it includes patients' priorities, perspectives, and experiences in healthcare. And so they're confident moving forward with their decisions in research and healthcare. This quote, in my opinion, is from an article on patient engagement and PCORI-funded research, and it nicely summarizes why engaging patients in research is so critically important. Research meaningfully informed by the patient perspective will be more relevant to the complex choices individuals face when it comes to their healthcare, allowing them to make better decisions in line with their own goals and priorities. So one question that is often asked is, what is the value of engaging patients throughout the research process? And overall, engaging patients as partners in research is viewed positively, and it's considered the right thing to do. But what's its impact? And currently, the evaluation of patient engagement is limited. Some studies have attempted to evaluate the contributions of patient engagement. A lot of it focuses on the near-term effects, such as evaluating the patient experience from being engaged in the different phases of research. And there's a lot of work that's ongoing to develop appropriate evaluation frameworks, specifically for evaluating those long-term effects of patient engagement, such as the impact on the outcomes, more salient health outcomes. How is that all linked together? Ismail and colleagues reviewed the patient engagement literature and summarized what had been reported in the literature in terms of hypothesized impact of engagement. And those are listed here on the slides. Researchers have reported that they believe that patient engagement has increased the translation, dissemination, and uptake of results. And this involves, for example, patient partners spreading the word about the research finding to patient communities, thus expanding the findings beyond what researchers normally do. We publish our findings in peer-reviewed journals, and that kind of stops it. By having patient partners, it could increase the research uptake because more people know about it, more people are talking to their providers about that, and it can increase adoption of study results into practice. Researchers have also reported that patient engagement can expand the applicability of research, and that's specifically also focusing on connecting to that hard-to-reach populations. And that then helps to address disparities in patient populations who participate in research, and it can also lead to research findings being applicable to more patients because a broader range of patients participated in the study. Due to time, I'm not going to go through all of these, but I wanted to include them, but I will comment on democracy and accountability before moving on. And so engaging patients in research can help to assure accountability of the behavior of the researcher. For example, it can show that public funds are being used in a way that benefits the patient population, and also can contribute to the credibility of the research because it focuses on what matters to patients the most. There are several frameworks out there for engaging patients, and I like this one on the screen because it's from the patient's perspective. And there's a lot of different folks on the call. We have researchers, there's patients. It shows you what the goal is for researchers, what the goal is for patients. And for researchers, this is nice because we should always be looking at things from the lens of patients so the best that we can. So to quickly orient you to this framework, it shows the multiple levels of engagement from left to right. So each column shows a different level of patient engagement. And so less time and knowledge is needed for those activities towards the left, and more time and knowledge are needed for those activities towards the right. And then if you look vertically, the cells describe the patient and researcher's goals for the specific activities, and then what's associated with that type of engagement. So we're going to talk about some of these in a little bit more detail, focusing on the purple ones and then on the green ones. So starting more towards the left, so this is less engagement. If you look at participate, this is to act as a subject or participant in a research study. This happens obviously in every research study. You can't do research with human participants if you do not have participants who participate in this study. This is included in the grid, although to me this is not, and to most people this is really not patient engagement. The next to the right, that consult category, is really, in my opinion, the first activity on the spectrum where you get some sort of improved patient engagement starts to happen. And this, it should not be limited to it, but it starts to happen. And this is when you consult with patient populations and other stakeholders, similar to the graphic that Courtney had with all the different stakeholders. You can bring different types of stakeholders into this consult process, but always definitely patients. And this is where you can conduct interviews, focus group discussions, find out about patients' experiences, their perspectives, their advice, and then use that data to make decisions. But moving more towards the right, you have your more meaningful collaborations. And while I think conducting formative research with participants is essential, I've been doing it for 20 years. I think it's incredibly important. I still think we need to move as much to the right and bring on these more, what I think is more meaningful collaborations and bringing in patients in different ways than is the norm really right now. And so if you look at these green categories, for researchers, it really is bringing in patients as equal partners in the research, where your patient partners can be co-Is or multiple PIs on the studies. And the research that I do, I'm in HIV prevention, and so all of my HIV prevention studies, I have a community PI. And this is someone from the population in which we're working with. And we don't work with patients, we're looking to prevent an illness. And so it's a member of the community who is always at the table while we are starting a new idea. And with some of my community partners, we've been together for a while where we have a list of all these activities we want to do, all these studies, and we're just looking for those funding opportunities. Looking specifically at patients and what patients can do in this lead support category is to start leading research activities. And the idea isn't that patients become researchers, but it really is, there's all these other activities that patients can still do to improve healthcare. And one great example of that is the OI's Foundation's, the registry that they'll talk about later. And registries are something that a lot of patient organizations have done to be able to contribute to the whole research enterprise. So what are the best ways to engage patients? So Harrison and colleagues reviewed the literature on best practices on engaging patients in research. And the next two slides summarizes the top practices they identified from this pretty large literature. So I'll summarize some of them. Starting with training and education. And this is important where it includes training for patients and researchers. And again, while training is not intended to turn patients into researchers, basically the idea is to be able to contribute meaningful, patients need to learn more about the research process and ways that they can work with the research team and how to feel empowered to be able to share your point of view. And researcher training should focus on how to welcome and incorporate that patient perspective into the process. For some researchers, that's a new topic. But one thing that we always stress, and Courtney got on this on one of her responses, is whenever we're working with a new group, we always want to stress that it is a true partnership in terms of, as researchers, we bring in that methodological experience. We are trained as researchers. We know what we need to do scientifically to have rigor in our studies and have people trust the results. But the patients and the community representatives bring in that angle, that unique angle, and is just as important as those research methods. And if you don't have both, the research that you're going to do is not meaningful and worth it. So the next one I want to talk about is compensation and reimbursement. And this was also talked about briefly in the question and answer session of the last session. In overall, when patients are partners in the research, they should be paid for their time, just as researchers are paid for their time. And so when for my studies, when we have a community member or patient representative that is a PI, they get paid a salary or paid part of their salary. They're on the budget, just like I'm on the budget. When we have task force or coalitions that are part of it, they have a stipend. Each one is going to be different. We have to figure out what is best. But the general purpose is we don't expect patient partners just to volunteer their time. We don't volunteer our time as researchers. We don't expect patients to do that either. And then in terms of the social science research, this got brought up too in the question and answer, we have always provided a compensation for people who participate in in-depth interviews or focus group discussions. And that is standard in the world of social science because typically there's not much benefit if you're participating in interviews. It's really the benefit to the researchers because we're learning from your experience. So we always compensate. And actually we always feed everybody as well. And we do that for all of our meetings as well. Food always is great for all of us. Clarifying roles and stakeholders is another one I wanted to mention. And I think this is really important to take time to understand patients' unique skill sets and experience and to decide early on how that can be used to really benefit the study. Everybody has their own experiences. Everybody has skills that can be uniquely helpful in the different phases of research. And finding that early on will be really helpful and beneficial to the research. And similarly, involving stakeholders early in the research. And in doing that really leads to this authentic approach of patient engagement, because you are engaging them at the beginning. Let's figure out what outcomes we want to focus on. And in the end, that makes it more meaningful. But also from a researcher point of view, bringing a patient representative in late in the game, no doubt they're going to have suggestions that would have been good to do earlier in the game. And now you're going to lose time making up for some things that you should have been doing from the start. And two last points I wanted to make. Appoint a coordinator to help manage. I strongly recommend having a coordinator that focuses on patient engagement. When I've worked on larger clinical trials, we've always had that. Investigators, researchers have to be meaningful, engaged in the intellectual contribution of patient partners, but they don't have to be engaged in the everyday logistics of doing that, because that does take a lot of time. And so we strongly recommend that a coordinator focuses on that so things do get done, things don't fall through the cracks. And the last thing is to have a budget. Budget time for your coordinator, budget time for patient partners, budget time for patient engagement. And some funders, as obviously we currently learned, require this and expect this in their budgets. But others are expecting it as well. And you just add it in there, even if it's not expected from a funding foundation. Harrison and also the same group we just talked to about, they summarized what they found to be key principles of engaging research from their review of the literature. And listed here are the ones that were most often mentioned in the literature, but of those, I wanted to mention the top ones, which are not surprising, that are really these key principles that need to be followed when doing patient engagement, and that is respect of stakeholders, and then equitable power, trust, transparency, and openness are just very key to be able to do this well. Other principles were also to show the importance of demonstrating shared decision-making, obtaining institutional support, and ensuring diversity of stakeholders and inclusiveness. And so we'll talk about that topic in a little bit more detail, specifically focusing on how to identify patients. So you've decided you want to engage patients, you bought into the fact that you strongly believe that this is going to improve what you're doing. How do you go about engaging patients? And really, engaging the right type of patients is just as important of the methods of engagement. And so the author here, Largent and al., they have published an article focusing on PCORI-funded research, and they provide guidance on selecting the right patient. And overall, their main words of wisdom are, you include a diverse group of patients, you'll learn the full range of patients' experiences, and this will lead to more meaningful outcomes in the end. If all the patients you engage are similar in terms of race, age, gender, and experiences, then the overall outcome will likely be limited to just those patients' experiences. And so they have identified 3 overall pitfalls of identifying patients, which are listed here. So the first one is relying on patients who are well-informed and well-connected. So these patients are also, usually PIs already have existing relationships with them, and they're very easy to get in touch with because of that relationship. And there's definitely benefits of having these long ongoing relationships. I can definitely attest to that. But the negative side is these patients may not be sufficiently representative of the range of patients and the range of their experiences. They could have higher literacy levels or access to healthcare systems, and then therefore they really might not be representative of everyone. And then you want to branch out a little bit. The second pitfall is kind of the reverse. Relying on patients who are not well trained and not well informed. And for patient engagement to be meaningful, patients must be empowered to contribute their ideas and perspectives. And then otherwise, if that's not done, it really does equate to tokenism, and we want to definitely avoid that. And the last pitfall is just an over-reliance on patient advocacy organizations. And they go into great detail about this, but basically the primary reason is the goals of patient advocacy organizations. Great to include as part of your work, but also it's great to include other people because patients' individual beliefs and needs may differ from the overall patient advocacy organization. So Largen and al. Offer several recommendations for overcoming these challenges, and I highlight 4 of them on the slide. So first of it is to engage more patients. This can include more patient providers that are at the table as you're planning everything, as you're implementing everything, as you're disseminating it. But also it can include doing that, but then also have a patient advisory board or also doing some formative research. So look at all the different ways you can engage more patients. Second is to purposely engage your patients. Purposeful sampling is a term that we actually use in qualitative research. It means that you purposely choose who you want to talk to because they can give you that rich information that you need to answer your research question. So the same thing for choosing participants to be part of your team. You know, you can identify the range of demographics and experiences you need and then purposely seek them out. The third is to reduce barriers to engagement. And this includes, say, removing financial barriers, be able to provide people a stipend, be able to provide transportation reimbursement, or provide online opportunities like Zoom for patients who are unable to make in-person meetings. Lastly, offer trainings to facilitate engagement. We talked about that briefly before, but that also includes making that available to a broad range of participants, not those that are just easier to reach. And to wrap up, I'll describe a little bit more about how you can get started. Overall, it's important to make a commitment to engaging patients in meaningful ways in all of your studies, not only for PCORI-funded studies where it's a requirement. And that starts by including staff, request funding for patient engagement activities, paying patient partners in your proposals. Next is really identifying what's a realistic objective for engaging patients for you. You know, you might not be able to do all the way to the right on that spectrum right now, but maybe that's where you strive for. What can you do that's more than what you're doing right now? And think about how you can identify patients in different phases of the research. Then you would choose your appropriate engagement method and then consider how you might evaluate. The next thing is really, and I touched on this just briefly, really strive for the highest level engagement while also considering multiple methods. So for example, you can collaborate with patient partners while you're consulting with stakeholders through formative research. So there's not just one approach that you take, but there's multiple ones. Look around your organization. Who can identify you and help you get started? Collaborate with them. These could be patient engagement specialists. These might be social scientists who can help you design some of this formative research to get more patients' perspectives. And then use the OI registry. And this can link you to participants. It can link you to other investigators. And that's something that will be talked about later on in the session. All right, now I will open it up to questions. I'm going to stop sharing my slides. Great.
So, Amy, this is Tracy Hart. I'll start us off if that's okay. In your experience, do you find constituent communities different? Like, I think the OI community is the very best community out there, but do you see a difference between rare disease communities and more common disorder communities?
Well, rare diseases communities typically are highly engaged because there's not a lot of funding that's typically allocated for rare diseases. And so you get these motivated patients, motivated parents that engage. I think every condition out there affects people though, and you can still embrace them. I think sometimes some communities aren't as used to it. For whatever reason, there hasn't been as much advocacy or as much just grassroots or encouragement to be able to be more involved in research. And I think that's something, I don't think that's the case in the OI community. I think there's a lot of patient groups out there that are interested in doing that. With other conditions, it's the responsibility of the researcher or group to really go out and look for, I want to bring you in on this. because I
We're losing you, Amy.
make my research. Okay, I'm not sure. All right, I'm gonna turn off my video then.
Yeah.
I'm going to just move to see if that helps. Does that help at all?
Yes.
Okay. All right, so I'll just move to the next question.
Sure. Thank you so much for your talk. So actually, we have a question here. So one thing we've been sort of thinking about, and is obviously if you're on this call, you are probably interested in the ideals of what you're talking about. But when you use using words like respect, inclusion, transparency, shared decision making, these are all great ideals we want to strive forward. How do you sell this concept to other clinical researchers and basic scientists who may not understand or appreciate engagement the same way?
Right. What I would recommend, and this is just from my experience, is showing what you believe are the benefits of that. So when investigators see that another investigator engaged patients in this way, and look at the information that you learned, look at what your outcomes were, look at how your research got disseminated far more broadly than just our journal articles. That to me has been a motivator for people to engage in doing this. I do think people need some assistance in doing it. This is something that we're all not trained on when we go to school about how to do this. And so partnering out with people, I think, is a big motivator, because some people know it's the right thing to do, but get bogged down with how am I going to really go about doing that? And there's people out there that can help. But overall, seeing examples of why this works and why it's more meaningful. And truthfully, as a researcher, it is more meaningful to be able to interact more regularly with the people who are eventually the recipients of your research. It is far more enjoyable than doing research without it. So showing those examples, promoting those examples, communicating more to our colleagues, trying to motivate them to do that, I think would be one step forward.
Great, thank you so much. We actually have another question here from the audience. This person is asking, what advice can you provide to researchers who are interested in conducting focus groups and qualitative research, but do not have experience or training in these methods? Should we learn how to do this on our own or partner with experts in qualitative research?
I highly recommend partnering with experts. So most institutions, academic institutions, will have social scientists somewhere on that campus that are trained to do that. So I lead a group called the Qual Corps, and there's a whole host of social scientists that are trained to do social science research, specifically qualitative research. And we work with clinical investigators on their ideas. They have these qualitative ideas, but they're not trained how to do qualitative research. They come to us, we work together. Similarly to what I kind of described before, the clinicians come in with their technical ideas that they want to learn. We bring in that methodological support, and together we move forward and be able to answer those questions. And so, I think to be able to find those partners, tell them what you want out, the end result, and they can help you design what's the best way to get that through interviews and focus group discussions, and partner with them to get that done.
Thank you. And we have one last question. Dr. Marini is on the call. I believe she's on her phone. I want to give you the floor if you would like. I believe if you're on the phone, you can unmute yourself by pressing *6. Dr. Marie, you know what? If we're going to try to get back to you, Dr. Corneli, we may circle back to you once we get in contact with Dr. Marini. So we actually do have a question from Dr. Cruz. How do you ensure a broad base of diverse patients to engage? And how do you find and engage those not already engaged?
Right. What we try to do is we look at what's the representation of demographics of the condition throughout the United States. if we're doing US-based work, and then try to find patient representatives that, that are representative of those different groups. So we want to be able to say that we have a diverse group that looks like what the US-based population looks like that has this condition. Finding people is hard, you know, and you do need to go start off with patient, you know, advocacy groups, even though that is recommendation not to rely too heavily on them, but they can link you. Different institutions, academic institutions might have other ways to find patient representatives, so I would reach out to them. But that's also specifically for the OI community. That is a big thing that Dr. Tosi will talk about later for this OI registry. That they really hope that is a way to connect people more in this community and to be able to work together on future studies.
Great, thank you. And we are exactly at 2:15, so we are perfectly on time. Thank you so much.
Can I ask a question?
Yes, Dr. Glorio.
Yes. First, let me say that I realized that I've been practicing PCOR for the last 40 years without knowing it. And maybe,
Great.
now, my question was really regarding one of your last slides when you talking about dealing with homogeneous or heterogeneous group of patients. And you had a tendency to say that it was more interesting to go to heterogeneous group. And I'm not sure that applies to OI. Could you elaborate on that? Or did I misunderstood what you said?
Well, I'm talking about principles in general. So how I would answer your response is to look at the distribution of demographics of patients with OI in the US, and then you would want to bring that demographic group into your research. If it's more homogeneous, then that's okay. But you do want to make sure that, you know, you get good representation from folks in urban areas, good representation from folks in rural areas, older, you know, young adults. You know, you still have some variety that you want to be able to include.
Okay,